Thank you, and welcome everyone this evening to our August 23rd study session. Just some updated changes since I asked for updated changes last time. With kind of capacity constraints in the building and things like that, we are going to continue live streaming both the study sessions and our regular board meetings. So just for those of you at home listening, we are going to continue to do live so that everyone has a chance to hear it live. Also, I'm going to make sure that just going forward that we do have silence during the board meetings. It is a time for us to, discern as a board and have board discussion, and I'm going to make sure that the audience is completely silent. So if I do hear of anyone making any noise, I'm going to ask you to leave, okay? And then signs are absolutely fine, just as long as they are not safety hazard to anyone and that they don't impede anyone's view. So that's absolutely fine, okay? All right. So with that, I'm going to turn it over to Purpose and Agenda with Dr. Stallo.
Thank you. Good evening, board members and our public. It's always good to have a full room. The purpose of study sessions is so that we can share information back and forth and make sure that board members have the information that they need to make wise and effective decisions at the board table. This evening, as we go through the agenda, you can see that the first item of business is under the oversight of operations is our Prior Lake Savage Area Schools Back to School Safe Learning Plan. We'll also hear a little bit about an enrollment update to see where we are, as well as a bond refinancing discussion. From there, we'll have a follow-up to the American Indian Parent Advisory Group written response that was presented a few months ago. We'll hear a little bit about the technology levy, move into shelter lease agreement. There is no policy this evening, so that is the end of the agenda for the evening. And I know that that aligns with Chair Ruel, the working document that the board uses to guide their work.
Okay. All right. So with that, I think we are at the Back to School Safe Learning Plan.
Excellent, good. Thank you, Dr. Edwards, for assisting with me. Again, good evening, everyone. I'm here with a team who's going to be presenting portions of this, and we're here on behalf of our entire admin team who has been working, continued to work through evolutions and changes into our recommendations of our Prior Lake Savage Area Schools Back to Learning Plan. We're excited for the return of students and staff and have really been planning for this for months, long before the end of last year. And our goal is to ensure that our students can be in school, in person, 5 days a week. And we wanted to be sure that we included some of those faces, right? As educators, teaching and learning is our expertise. And we're really good at working with students and providing them the opportunities for high levels of learning and support. During the COVID-19 pandemic, we've been challenged to do this very differently. And in order for us to continue to remain agile with the changing landscapes, we know that we've had to have a lot of intentional planning. We always prioritize a safe and healthy learning environment for teaching and learning. And this year, we have been even more intentional about the planning for the beginning of the year because of the lessons that we learned through last year in preparation for the upcoming year. So our outcomes this evening, thanks Dan, our outcomes this evening at our last board meeting on August 9th, we shared information about the district's health and safety protocols, our safe learning plan, as well as information about Laker Online. We discussed our ongoing collaboration with Scott County Public Health and our discussions with them and other school districts about using a decision-making matrix to guide safety protocols, especially those around masking requirements. Tonight we'll share that information. We also have Lisa Brodsky from Scott County Public Health joining us virtually on this meeting. In addition to the health and safety, we'll also be sharing information about the academic and social and emotional that has been in place as well. And at the end of this meeting, I will be asking board members for consideration of a board resolution around the health and safety measures as we open up the school year, much like we did last year. So with that, the presentation this evening, as always, is aligned to our strategic plan. Tonight we'll be talking specifically about the strategic directions that center around improving student achievement, school safety and social emotional learning, and the engagement of our students, staff, community members, and parents to strengthen a culture of respect and inclusion. The intentional planning with which we have done to navigate the pandemic is aligned to those strategic directions. It looks like they're going to fly in, so you can go ahead and have them all fly in at once, Dan. We've got district administrators who really will be focusing on that priority work, especially at the beginning here around strategic directions 1 and 5, our academic and social and emotional learning, and then we will move later into the safe learning plan and the strategic directions that align to that. So with that, I will go ahead and hand it over to Dr. Dan Edwards, who is our Teaching and Learning Director, to begin the presentation. Then he'll be sharing this time with colleagues.
All right, so I'm going to be the first of a few administrators who are going to speak to our work in Strategic Direction 1, and specifically the areas of instructional excellence, MTSS, multi-teach systems of support, and educational equity and excellence. And I'm going to jump in with the first one on instructional excellence. Just as a brief reminder, what is instructional excellence? Here in Prior Lake Savage Area Schools, we definitely have had taken the lead, we feel, very strongly about our Laker Learning Compass that guides our work, and we feel that that compass has given us great direction to personalize the learning experience. And we were, to recall or recap, we were on that journey prior to COVID. But most definitely, as Dr. Stallo pointed out in her opening comments, we learned a lot during the last 18 plus months. And our implementation of personalized learning looks very different and looked very different and will continue to look different as we move forward. And what personalized learning has taught us during this time is the importance of being able to do that. As we, throughout these past 18 months during COVID, we had to, as we know, shift our approaches. We had to get devices into hands of students who didn't have devices to personalize their experience so they could learn interactively at home while we weren't able to be in person together. And throughout that, I think our focus here of teacher-directed, student-centered, and student-driven came to reality. That being said, we learned a lot during COVID about how to do that and do that better, and we're looking forward to Workshop Week next week when we get all our staff back together and we can take those lessons that we've learned and build upon them. For example, just give you one concrete example. One of the things we're going to do on Tuesday morning is bring teachers together in a vertical conversations across grade levels to have the opportunity to benefit from first grade teachers teaching second grade teachers what they need to know about the incoming class to them, for example. And we're building time into our staff development time on Tuesday morning for that when teachers report back. So just one example of the work that we're going to do to lean into what we learned and move that forward for the benefit of all, and obviously for the benefit of our students. One of the other things that we've also learned through this time is the importance that, once again, the Student Voices project work that we did last year, that really came to fruition throughout the year as we learned so much from our students throughout the process. And as we move forward, we want to capitalize on that learning. Again, the point of emphasis here is that students and teachers have had a shared responsibility, always have and always will, that we work in partnership to achieve that instructional excellence framework that we pride ourselves on in Prior Lake Savage Area Schools, and use that compass to guide that work. So we are going to continue that learning journey. And again, we had 23 new teachers in this morning who we, along with 23 mentors to support that work. And we had a great gathering with them today and took them on a bus tour and bringing them into Prior Lake Savage Area Schools and helping them understand what this is all about to be a member of Prior Lake Savage Area Schools, helping bring our great work forward. I want to give you a brief, while I have the floor here for a moment, give you a brief update on Laker Online. As you know, 2 weeks ago, I was here presenting to you that we had received approval to be a provisional online provider. In early August, we received that approval, and on August 9th, we presented a staffing proposal to you to get us off the ground and running. And that was a 3 FTE proposal, 2 at the elementary level, 1 at the secondary level. We opened up the registration as we said we would, August 10th through the 17th. And I'm pleased to report we had a strong response, demand, if you will, 148 registrants, K through 12. And that's certainly our initial, when we presented the staffing, we didn't know what to expect per se. And so we are coming back tonight and requesting, and this will be a part of your school board meeting on Wednesday in a formal sense, requesting 2.0 additional classroom FTE to allow us to align with our current class size targets across the district and what that would look like. More specifically would be 1 additional one at the elementary level and 1 additional at the secondary level. Again, as we spoke earlier, as I spoke 2 weeks ago, we'll be having some grade banding going on, and this will allow us to do so. Again, this is acknowledging the existing registrants that were within that time frame, that original 10th through the 17th, as well as a 0.5 FTE to support. We do have students who are coming to us and have IEP needs, and so we need additional support to support the needs of those enrolled students. Now, later on this evening, as we continue this presentation and look at the Safe Learning Plan, we are prepared to make the adjustments necessary, should there be adjustments around Laker Online. We will be prepared to do that according to the future of this agenda and work study session this evening. So, and I certainly will be available to help clarify what that means as we move forward. So with that, I'm going to turn it over to my multiple colleagues, but first I'm going to turn it over to Ms. Goodman.
Thank you. The area of focus I'm talking about tonight is multi-tiered systems of support, MTSS. At its core, MTSS is about finding out where students are and providing them what they need. So that's represented here in the diamond, all students receiving a differentiated, rigorous curriculum, some students needing intervention, some needing enrichment to ensure that all of our students are appropriately challenged and engaged, both academically and socially. Now more than ever, it's important to know exactly where our kids are, to meet them there and provide the supports they need to get them where they need to go next. So MTSS begins with assessments which give us information about individual students. That drives the work teachers do, making database decisions. And we've already made some intentional changes to Great Start to Kindergarten and assessment days at the elementary level to ensure that we understand student skills and provide opportunities for students to engage. That multi-level instruction is what teachers are providing based on the information that they have about students. And then part of the infrastructure and support are problem-solving teams, and that's another action that we're taking. Tomorrow, all day, is the first of a number of problem-solving team retraining so that all buildings and schools work to the same standards throughout, and that's part of that fidelity and evaluation as well. We looked at what was happening across the board, and this is a way that we can ensure fidelity. All right.
Good evening, Superintendent Starlow, Chair Ruel, and members of the board. Tonight, I have the privilege of explaining the priority work around educational equity and excellence. Educational equity involves meeting students where they're at and giving them what they need to succeed. As a district that focuses on instructional excellence, it is important for us to understand that our students come to us with different lived experiences, different resources, and different personal approaches towards learning. All that was explained to us, again, through the lived experience of the pandemic. So to put it simply, what we do in educational equity is we want to make sure all students have what they need to be successful. We want to ensure everyone feels a sense of belonging, and we want everyone to be respected for who they are. This ensures that this makes us have to celebrate and validate what our students are coming to us with and making sure that they feel safe and welcome in our school district, regardless of their lived experiences. Now, what we do, we have committed a lot in terms of professional development around equity here. One of the pieces that we were committed to is CLR, culturally and linguistically responsive teaching. These are some of the strategies that are put in place here that helps us achieve our goals in equity, and those goals are to be able to increase engagement, to deal with inequities. We are committed to closing the achievement gaps, and there are disparities here amongst our different subgroups in education. And ultimately, and most importantly, we want to give our students outrageous love. Like I said earlier, we want to make our students feel welcome and safe in our school district. Now, some of you have received emails and phone calls around CRT, critical race theory. So those emails may have asked you, do we teach CRT in our classroom here? To put it simply, we do not teach CRT in our classroom. We do not. CRT has to do with a legal theory that was established 40 years ago. What we do is not CRT. What we do is culturally and linguistically responsive teaching. And basically what culturally and linguistically responsive teaching is developing a knowledge base about cultural diversity. And our school district is very diverse. The last I looked, we had over 40 different languages spoken in our schools here. We make sure that our students feel represented in our curriculum and our instruction. We want to be able to take their lived experiences and bring it alive in our instruction here so students can feel like they are being appreciated in terms of our education. And like I think we've said before, it's important to hear from our students because they have a lot to bring to the table in terms of educating, knowing what's best to educate them. We want to build caring and collaborative communities, and we want to honor our diversity and respond to any concerns around our diversity here. And that is culturally and linguistically responsive teaching. It's CLR, not CRT. I will turn it over to Deb.
So the work of social emotional well-being is super important to us this school year, especially as we're coming back. We had the good fortune of being able to prioritize this work with 160 plus staff members last week when we had our building instructional leadership teams in to kick off the school year. We used the opportunity with those building instructional leadership teams to set the stage for this upcoming school year. And we look forward to presenting this information to all staff next week. Oh, I guess those just flew in, didn't they? All right. This slide highlights some of the programs that we currently have in place in the district to address the student social emotional learning needs. I'm just going to highlight a couple of them for you at each level. At early childhood is the pyramid model, which is very similar to PBIS, which is a K through 12 initiative. Elementary is second step and responsive classroom. Middle school has PS. Growth produces success is what it stands for. And the high school is in starting year 2 in the BAR model, which is building assets, reducing risks. So just as we have academic standards, we also have social emotional learning standards. And the standards are based off of CASEL. And we are going to be focusing on these 5 competencies then throughout the school year. So we'll just continue to dig deeper into the work we've already done. Kate?
As Kate's coming up here, I'll go ahead and, and transition a little bit. You just heard about the intentionality that our leaders and staff have been using in response to planning for our academic and social and emotional needs of our students. Strategic direction number 5, which Kate is pulling up right now, also calls us to maintain priority work around the physical health and safety of our students. In consideration of the importance of ensuring success as we continue to navigate the COVID-19 pandemic, we've continued to be intentional in our safe learning plan and the health and safety measures. Our goal, like I said before, is to keep students in school learning in person 5 days a week. And in order to do that, we must have students and staff who are safe and healthy. We did communicate our Prior Lake Savage Area School back to school safe learning plans initially to our families on July 29th. We presented here the safe learning plan on August 9th to all of you, and then after that, we put that information on our website where we invited input and feedback, and we certainly got lots of feedback and input from our stakeholders. We appreciate your experiences, sharing your experiences, your resources, and your perspectives with us. On August 9th, we also discussed our continued work with Scott County Public Health and shared that we were reviewing options to see what kind of a matrix we could use to use data for decision-making. We had been talking with Scott County about that, also talking and collaborating with other school districts about that as well, and to see if there would be something that we could use to determine when we would make changes in terms of safety protocols and mitigation strategies. At this point, I believe Lisa Brodsky from Scott County Public Health is online with us, so I'd like her to share a little information with us, and then at that time, I'll ask Kate Kyle, our Director of Health, our District Health Coordinator, to share information about our matrix, about the recommendations that have come from our Incident Command Team.
Hi, Lisa. Can you hear us?
Hi, I can hear you, I can see you, I can't see my slides yet, but there we go. There we go.
Perfect.
Yes, I can see it now. Thank you very much for inviting me today to speak with you, or this evening, to speak with you a little bit about COVID and an update. My caveat is what I'm going to say today may not be true tomorrow. This has been an ongoing challenge to keep up with the very rapidly changing information. Next slide. I included this quote, "We declared victory too soon." This is from Commissioner Jan Malcolm a couple of weeks ago, and it's so very true. We, both the county and the state, sunsetted the declaration of emergency. We started putting our supplies away. We pulled back on vaccinations, and now we have a resurgence of Delta variant cases. Next slide, please. This is what, from the beginning of COVID, from 3/17, when Scott County had our first case, to today, what we have seen. We started with very little cases, which went up quite a substantial amount in November of last year. And we did expect that second wave, which you see here. And what we didn't really expect was such a rapidly escalating third wave. This is how I'm defining this. As of last week, we've had 18,230 cases in Scott County, and unfortunately, we've lost 134 of our residents to COVID. Next slide, please. This isn't only in Scott County, it's not only in Minnesota. I've pulled the CDC as of just a couple hours ago, what the entire United States looks like. Mostly we're red, except for in a lot of places that, a couple places that have lower population, you'll see the yellow. Red is high transmission. The orange represents substantial transmission. In Minnesota overall, we're about in the 150s as a state. We're doing a lot better than some of the southern parts of the country, where, for example, Florida has 636 per 100,000 in the past 7 days. We're at about the 150s. And then you also see the state map of Minnesota here. Scott County has been in the high range, high transmission for the past week or so. Next slide. So this is the 7-day total rate for the past 7 days per 100,000. We're at, the number's really tiny on my slide, but I believe it says, as I recall, is 155. This is the per 100,000 past 7 days, and that's a rolling average. So I want to talk a little bit about how to interpret this number, because last year we looked at something very different, and I do have that slide coming up here soon, but this is a very different number than we looked at last year. Although this isn't a new number for the CDC, this is how the CDC calculated it pretty much over the time of the pandemic, and Minnesota chose to use a different rate. And I'll talk a little bit about that next. Next slide. So what we've been used to for the 2021 Safe Learning Plan was a rate over a population, a 10,000 rate, where we took the total number of cases over the past 14 days and divided that by the county population over 10,000. So, and I also actually included the learning parameters here, but that gave us a 14 rate per 10,000. We had some big changes happening at about 30, where hybrid learning was for all elementary school, and then we also sent the secondary kids home at about 30. The community transmission rate of 155 per 100,000 is in 7 days is a lot closer to 15 per 10,000. So what we have done, next slide, what we have done and what we continue to do for Scott County School District, even though the Minnesota Department of Education has retired that calculation, we have continued, Scott County Public Health continues to calculate that rate for our school district, so we can see kind of what is the pattern, where is this going, and to try and be able to compare apples to apples for our decision making. So if you look at this slide here, I have right from last year until 8/1, 8/14, and that yellow bar across there is the 30 number. So we're pretty much where we were at last year at this time. I think as of today, the 8/8 to 8/21 is a little bit over 30. So we are over that 30 cutoff. And that again is past 14 days, rate per 10,000. Next slide. So another quote from the Department of Health: everything has changed and nothing has changed. Next slide. And I say this because when we look at the start of the school, 2020 and 2021, you can see that graph. This is broken out by age group. We've got the blue is 0 to 4, the green is 5 to 11, and then I believe it's black are the older kids. We kind of identified a comparison from last year to this year. We are in some cases right on almost exact for the older kids and a little bit higher for the newer kids, but it's pretty close to where we were at this time last year. So that hasn't changed. Next slide. Here's some things that are a little bit different and why we need to pay attention to this. Last year during the fall surge, children under 10, roughly about 5% of the, represented about 5% of the cases, and 10 to 19 were about 12%. Just in the past 2 months, that doubled for those kids under 10. We're at about 9.6. And 10 to 19 is just a little bit higher at 13%. A really important statistic that I've added to the bottom here, since 12 of 21, about 1.8% of the cases were among children under 10, and 1.5 of the cases 10 to 19 were hospitalized. This is more than double of what we saw in November and December of last year. So it does appear that with the higher viral load, kids are being more affected than they were last year. Next slide. I just want to talk a little bit about what's the role of the CDC, MDH, and local public health. These are recommendations from the CDC of what it's going to take to get kids back to school safely. They are recommending universal indoor masks for all students, 2+, staff, teachers, anybody that comes into the school, basically. 3-foot social distancing, a regular testing plan throughout the year for those that aren't vaccinated, and also just monitoring those outbreaks. Next slide, please. MDH's recommendations are very similar. When they talk about the best practices for COVID, they've got all their recommendations there. Vaccinations, of course, will be our number one, and is continuing to be our number one remedy for this. We're looking at, I believe the breakthrough case rate is now at about 0.24%. So we do know that the vaccinations are working, and will be recommending some boosters soon. But consistent and correct use of mask use. Again, MGH also strongly recommends masks. In schools, ventilation and hand washing and regular cleaning. I know the school districts, when we meet weekly, their plans are very thorough and cover all of those things. Next slide. So what is local public health role? What we're doing, we are, the current recommendations for public health right now include a boosters for immunocompromised individuals. That should be finalized for us at August 30th. And we are hearing that eventually we will be doing the third round of shots for those that are about 8 months out from their second dose. Vaccinations for children 5 to 11. We were hoping they would be here before school started. Unfortunately, that is not the case, and they do keep pushing it back. The last I heard was at the end of this year. But at the school districts we've talked to them. As soon as we get those vaccinations, we'll be out in the school districts offering those shots as quickly as we can. Sometime in the future, we don't have any dates on this, but again, vaccines for children 0 to 4. We will be recommending, for local public health, we'll recommend that those kids see their regular primary physician. They are often at the physician for their regular vaccinations, and we hope that the primary care providers will be able to, the pediatricians will be able to absorb those COVID shots. We continue to do case investigation, and there are going to be some, I understand there's case investigation requirements for the school districts as well, and that will continue. And then COVID testing, providing some of that COVID testing. We'll be doing some more COVID testing, or at least provision of COVID tests for some of our cities and local partners that are requiring that. So regularly we meet with the superintendents once a week. We've been meeting, seems like a really long time, almost 18 months it feels, 2 years, 3 years, I don't know. It's very ongoing. We see no end in sight, but they're great meetings. They give us an opportunity to talk about what's going on in the schools. The superintendents have a wonderful, and particularly Terry, have wonderful finger on the pulse of what's going on in the schools, how many cases, what we're seeing. We strategize, we talk regularly. I try and find data. This is a very data-driven decision-making process that we have when it comes to what are the recommendations that we are supporting. And next slide is just if anybody has any questions.
Okay. Any questions from the board? Anybody? Jonathan?
No, I don't think so.
Julie?
Okay.
I don't
A
think
big
so.
thank you.
Yes, thank you for
No,
being here.
no questions?
Nope.
Certainly was a lot of information.
Yeah, go ahead, Enrique.
No, I was just curious on the local public health recommendations that were provided at the end. I was trying to take notes as quickly as I could. So the recommendation is ages 0 through 4 get vaccinated through the primary care providers, 5 through 11. Did I hear that would be administered in schools? Did I hear that correctly? Or testing in schools?
No primary physicians.
If I heard the question correctly, our plan is to be in the schools doing vaccinations for 5 to 11 as we were in the schools doing the 12 to 17. And when the 0 to 14 vaccination comes, likely at that time, and that could change, but the discussion around at least the metro local public health jurisdictions is that we are recommending that they go to their pediatrician or primary care providers for those vaccinations. But again, that could change. But we want to capture the best place to capture kids. We did this during H1N1 as well. Best place to capture kids is at school during the school day.
Okay, thank you. Lisa, I do have, can you just go back to the rate that you had for the past 14 days? I think you had 26.85. I just wanted to reiterate what that was.
Yep.
And what you had seen for a trend in the last, because I remember hearing, I thought at the last board meeting, I'm trying to, do we have it
I'm
at the
sorry,
last?
I can't hear the
I'm
question.
just trying to remember what we had at the last, what our last
I think it was 14
14,
something.
2 weeks ago?
Yep.
So, we're seeing
Yeah.
and then did I hear you say 30? Or we're right at 30?
Yeah, we're a little bit over 30. We're at about
Okay.
30. And this is from calculating it to yesterday. And it's calculated based on the date that the test was done. So that number could go up. So we're at the minimum, we're at about 30.65 as of tests that were done yesterday. But it usually typically takes 48 hours. So my guess is by the time all of the testing comes in, we'll probably be closer to about a 31, 32.
Okay.
And my records indicate, and Lisa, I could be wrong on that, but the week ending July 31st, I have 12.
I'd have to go back, but looking at the chart, I mean, yeah, it looks about half of that. And, you know, when we talk about number of cases just over the past few weeks, like it was about 6 weeks ago, we were seeing under 10 cases per week. And then it jumped really quickly to 50, almost 53 cases. And then we had 86 cases. And then it was almost doubling after that. We were seeing 160, 200. We had about almost 300 cases in the past week.
And I know, Lisa, again, I know we didn't ask you to have this ready, but you were in our incident command team meeting on Thursday. And I know that, well, during the meeting, there were some questions about the age span of those positive cases. Yeah, do you have any of that information that you could share with us?
I don't have it for this week calculated yet, but, and that's another little bit of a difference. So up until about 2 months ago, about 15.1% of the cases were 19 and under. Right now, when we look at those cases, it's been hovering between 22 and 25% each week have been 19 years old and under, so it's the school-age kids. So we are seeing a lot more cases with the school-age kids. And the graph is very telling because we hardly have any cases with the 65 plus, which really jives with our the fact that we've vaccinated about 99% of our 65 plus in the county.
Jonathan?
Lisa, could you just say that one more time? 99 of the,
Quiet down, please.
just so I'm clear.
65 plus, people who are 65 plus in Scott County, our vaccination rate amongst those who've had at least one vaccination is 99%.
And we have,
And conversely, we are hardly getting any new cases of those that are over 65 plus.
And
thank
then,
you.
Lisa, can I ask, do you have the vaccination rates of the youth?
I do. We're overall about at 43%.
Is that like 0 to 18 or what, I guess 12 or
12.
13?
That would be 12 plus because we can't vaccinate.
Right. 12.
Anybody under 12 yet. It's 43. I don't know if, Kathy, do you have that green and pink slide I sent you last week?
It was presented at the last board meeting, I think, so we could.
Right. Yeah, I remember. I just want to.
So they're it's trickling in. It is changing over time. We did go up substantially. I think I have a more up-to-date slide that I could send you after the meeting. I think it went up 8% since we first did that slide, and that to me is very positive. That the kids are out there, they're getting vaccinated, a little bit at a time, but quite a few of them, sports-related opportunities. I mean, they're getting there, but they're nowhere near where we need to be. I believe in order to get kind of that community immunity, we're going to need to see at least 80-85% with levels of vaccinations before we, or hopefully before we stop seeing any of the variants. 96% of the cases in Minnesota right now are Delta variant, according to the Department of Health. So.
Okay.
And it's much more contagious, whereas the original Alpha variant, the R naught, or how many people you give it to, was about 3 for the first wave. Delta variant, you're looking at about 7. So it's twice as contagious, and the viral load is much higher. So those are some of the differences right now.
Okay. Any other questions? All right, thank you, Lisa.
Thank you, Lisa.
Thank you. Have a good night.
Thank you.
Thank you much.
Before reviewing our COVID-19 decision-making matrix, I want to review COVID-19 testing opportunities at school. At this time, families will be provided resources to pursue testing in the community. Routine testing will not be conducted due to difficulties gaining legal consent, the school's inability to hold multiple ill students.
Quiet. Quiet.
The school's inability to hold multiple ill students and staff safely in the building, and concerns regarding staff handling potential positive COVID-19 test kits. Prior Lake Savage area schools will partner with local public health if needed to provide on-site testing in the school community. As Terry mentioned, we want to ensure we have a plan in place based on the COVID-19 case data. The recommendation from the COVID-19 Incident Command Team is to use the following to matrix for mask decision making. The level corresponds to the same unit of data the Minnesota Department of Education and the Minnesota Department of Health used last year to make decisions on the learning model requirements and COVID-19 protocols. The district will review school district and county case rate data, as well as Minnesota Department of Health and CDC guidance with our COVID-19 Incident Command Team each Thursday. If the Scott County case rate exceeds 20 per 10,000 in the last 14 days, and the trend suggests that the rate increase is going to continue, Prior Lake Savage area schools would require masks for all children in the school setting, including early learning through grade 8. Adults working in these settings would also be required to wear a mask if working with or around students, regardless of vaccination status. If the Scott County case rate exceeds 50 per 10,000 in the last 14 days, and the trends suggest that the rate increase is going to continue, Prior Lake Savage area schools would require masks for all students, staff, and visitors, regardless of vaccination status. Based on our most recent data from the week ending August 14th, our current 14-day case rate is 26.85. COVID-19 case rate data ends each Saturday, but remains preliminary for 14 days. Our partners at Scott County Public Health give us a calculated case rate 5 days after the week concludes to help us determine as soon as possible what's occurring in our community as far as COVID case rates. Based on this matrix, if board approved, we would be beginning the school year requiring masks for students and staff in the early learning through grade 8 buildings. In addition to the COVID-19 case rates in Scott County, other decision-making factors would include our trend data, influenza-like illness cases at each building, positive COVID-19 cases at each site and in each classroom, and district staffing and operations. In addition to using Scott County case rates for decision-making, Prior Lake Savage area schools will also utilize additional local data for decision-making. I will review influenza-like illness data at each school daily. Influenza-like illness is defined as a fever of 100 degrees or higher, accompanied by a sore throat or cough that is not related to any other diagnosis such as strep throat. The COVID-19 Incident Command Team will review ILA data at each site weekly and utilize the matrix above for decision-making. If the ILI rate exceeds 3%, the Incident Command Team will determine if additional mitigation strategies need to be implemented at the specific building level, which could include requiring masking, increased social distancing, or another mitigation strategy. Absences due to illness without specific symptoms would be reported in that ILI case rate. Each building will track COVID-19 cases, and I will review this data daily. The COVID-19 Incident Command Team will convene immediately if 3 or more COVID cases occur in a classroom or specific building rates drastically increase. The Incident Command Team will determine additional mitigation strategies that will be implemented at the specific building and classroom level to include requiring masking and possible quarantines. Prior Lake Savage schools will also be reviewing staffing as far as absences, substitute fill rates, and position openings to determine operational capabilities. Department and school level data will inform the COVID-19 Incident Command Team to determine if additional mitigation strategies will be implemented at a building, department, or district-wide level. Questions?
We can just go on to the resolution, and then they'll be ready for
Sounds good.
questions, I'm sure. As you can see, board members, we have intentionally planned both the academic and the social-emotional needs of our students. We've intentionally planned for preparing the year with those things in mind, those lessons that we learned last year as we were in navigating the pandemic. And we've also been really intentional with how we're looking at the safe and healthy protocols right now as well, in terms of between the last meeting and the conversation we had into where we are tonight with our recommendation. We're happy to answer any questions. Again, what I would be seeking from you is approval on the resolution, the health and safety measures resolution, that you have a draft of that would direct me to implement a safe learning plan, and then to continue to monitor, work with our command team and all of you to make decisions throughout the year as needed, similar to what we did last year. So with that, I've got a team of folks who are ready to answer any questions that you might have.
First of all, I want to say thank you. This is a lot of information. I know you've been working long hours to gather data. Thank you to Lisa as well for bringing it together. I'm sure you're not getting a lot of sleep as you navigate all of this. I also want to thank you because, as I recall from our last meeting, when we presented the Safe Learning Plan, the board provided some consensus that we would like to see some metrics so we know what we're looking for if we needed to adjust or change. So I want to thank you for the time you put into doing that. And I'll let my fellow board members comment on that. So the question I have after listening to data here is, you know, Lisa was very clear in the trends she's seeing. It's interesting to hear the data broken down by age groups and comparing it to last year and having accurate numbers. How is this variant different? We don't know what the FDA's plan is, when we will have access to a vaccine for those kids. So the listening to that data, and also, you know, we've all had several phone calls and emails since our last meeting, and including talking to, I've spoken to medical providers in our own community and pediatric ICU staff. So for the sake of discussion, I love having the metrics, and is it worth considering that we K-8, where we can't, where nobody has a choice, if they do or do not want a vaccine, that we start with masks, watch the data, watch the trending, and then kind of go forward from there. So in other words, I understand by looking at the data now, based on the metrics you've provided, we would start in masks anyway. I would push that we be just a little bit stronger and get into our school year and watch the data coming in. Does that make sense, as opposed to strictly metrics? Now, at the high school level, people had the choice to get the vaccine or not, so I understand that firm recommendation, and that if things get out of control and it's a wildfire, that we're going to have to implement safety measures for their sake. So for the sake of discussion with fellow board members, I'm kind of feeling like not an open-ended all year, but until we kind of see where everything's going to settle after school starts and perhaps when vaccines are available. Do we want to tie it strictly to metrics, which nobody, state or federal, wants to provide school boards right now, right? It's getting passed along. Or do we want to be a little more firm on that? Does that question make sense? Okay.
Is up for discussion? Anybody?
I'll hop in. You know, what the guidance coming from all the public health folks is highly recommended, highly recommended, highly recommended, which last year, I think the governor and the Department of Health here in Minnesota said, I'm going to step in the breach and I'm going to be the person who calls it and says this is what we're going to do. And they kind of took all of us local school boards off the hook because the decision was made for us. Now we have to. And there certainly is a part of me that interprets what the CDC is saying and what the Department of Health are saying. Their recommendation, which means that they want us to mask kids that aren't vaccinated. And so there certainly is part of me that would feel comfortable and support the idea that we say we're starting with masks E to 8 until sometime shortly after a vaccine is available for those students. I don't need it to be that, but I'd feel good about it. I also feel good about I like that we're using a metric and we have something in place that is numbers that are guiding it. So that's a wishy-washy comment, I guess, a little bit, but I would be willing to talk about it open-ended. And I am okay with older ages, it being an optional, or it being recommended, highly recommended at the high school. We do have, what did we say, 43% of that population have gotten vaccinated, more continually getting there because they can. Feel better about that because that's a choice.
Any other comments, questions from anybody?
Yeah, I'll comment. Yeah, you're right, Jonathan. MDE, MDH, the governor, they took the hit for us last year. This year we get the benefit and the bane of local control. This is kind of what we get right now. So it's up to us, and I appreciate being in this position that we have that control to be able to look at the data that's before us for our community, to look at what we have in our population and the data. I am a data-driven person. I like to take the emotion out of the equation and just focus on what it is we're trying to accomplish, and seeing that where we are, what the trend is. I'm not quite as wishy-washy, to use your term, as far as saying once the vaccine is available, then we can revisit that, the decision. I like to focus on where exactly are we with the data? Do we see that the numbers are coming down? Do we see that we are consistent? Not just we hit the number, great, and then see things run amok again after we make a change. We want to see at least 2 cycles where we hit that specific number so that we can move in the positive direction and don't go back. That's the biggest key for me.
Would you mind just clarifying, are you talking with those comments? And thank you for those comments, because I know eventually I'm going to need some direction. So I just need some clarity. Are you talking PK8 or PK?
Sorry, yes, PK through 8, yes.
Okay, thank you.
Any other?
I agree, first of all, with Michael. Thank you for all your time and information. It has changed rapidly since we were sitting here back in July. You did say one thing that I wanted to clarify. You said that if there was flu-like symptoms or it was not reported as anything, you would put it in the bucket of
Yes.
influenza-like symptoms. I would, in my opinion, looking at even just numbers in the high school, I mean, you can have a lot of students out of that building in one day. So I don't know
Yes.
how you can hone in on that a little bit
So if
better.
someone would call and say, I have my child homesick, that would be where we really want you to tell us why are they homesick so we can know if we have enough.
Stop, please, otherwise we're clearing the room.
We just want to be sure that we're looking at what's going on in the school, and that's the best way for us to look at what is actually going on in the school. By having that data, if there is 80 kids out, we just don't have the capability to call for a nurse to be calling the parent and asking what's going on at home. Is it an influenza-like symptom? That's why we would do that, and that's actually a Minnesota Department of Health guideline that was established during flu season, and it is not specific to COVID.
Okay, thank you for that. I, of course, wasn't here for the last trends, but we went back and looked at all of that. I really believe that kids need to be in those classrooms 5 days a week, in-person learning. So first and foremost, yes, we need some matrix to guide us, but whatever strategies we can put in place to keep our students in our buildings, I want to see that put into place. Knowing that we can't socially distance, I believe that if a mask has to go on a face for a couple weeks or a month or until they could get a vaccine, I think that's crucial to keep them in our buildings. That's the first part. Second part would be, as parents try to plan ahead, we had a lot of contact tracing going on last year, and you may be sitting next to somebody, and then you had to get sent home. I would say, as we look at this and use our metrics as a guide, I still would like to see us be able to not send 9 students home because one student had COVID. So if a mask would prevent that for a period of time, while the numbers are high, I would be all for that, because I think we are all, it's a very polarizing conversation. We've gotten lots and lots of emails and phone calls and very passionate, but I think everybody would agree students need to be in-person learning. So if it requires us, I'm all for K-8 to have a mask if it allows us to let them be in buildings, in classrooms, next to their friends and learning in person. And at the high school level, I'm a little more flexible on saying, let's see what that does. There's been vaccinations and they're allowed, so I would be tending to put a little higher number on the high school number. That's just me.
Can I just jump on Julie's point on the contract tracing, because I think we talked about this last time. So we wouldn't be doing, or what do we require to do?
Our plan was that we would just alert parents if there was a positive case in the classroom and allow them to decide if they wanted to quarantine. If students are wearing masks, they aren't considered to be a close contact anymore per the Minnesota Department of Health guidelines.
So then we would still have to notify them.
I would still notify parents, but they would not be considered a close contact anymore, those students, if they were masked. So that would be kind of taken off the table, so to speak, as being a mitigation strategy.
Okay. Good enough. Amy, did you have questions, comments?
Yeah, I mean, the priority is in-person learning, and that's the priority for us as we sit here, and it's not where we want to be, right? We want to be where we were in July, where numbers were lower, and they're just not, which is hugely disappointing. Because like I said, we don't want to be making kids mask. Nobody here wants to be doing that. The problem is, with the E8 population, they cannot be vaccinated. They have no line of defense. And with the high school, they do. And I have a hard time putting numbers around any of this, because I feel like that backs all of us into a corner. And if we know one thing, the one thing we know is it's going to change tomorrow. And so the numbers we have today are probably going to look different tomorrow. So, I mean, if the administration wants to use numbers to to guide, I think that's fine. I just don't think it's something that we can hold on to. I think it needs to be fluid. And, you know, if I don't agree that we keep E8 and masks if our community transmission rates go down and we're in a valley, then I think we can take them off regardless of vaccination status. But right now, that's not the case, so.
Okay. So, I mean, I think what I'm hearing is in-person learning is important. I mean, obviously, for everyone. And we have, we have for mitigation strategies, 6-foot distancing, we're not in cohorts, everybody's sitting by whoever they want at lunch. I mean, everything for all intents and purposes is back to what it was before March of 2020. And I think the concern is what we're seeing in trends for the rates. I mean, since we've sat here at the table, it's doubled, basically. And I think it's a huge risk to go into having, 8,000 kids jump into buildings and not at least have some type of mitigation. And I do agree. I think it's hard to say, what do these numbers mean? I agree with that. And so I think what was important to remember is last year. Last year, we had regular updates brought to the board table every 2 weeks, really. And then it was fair, and when there was changes to be made, we made them. We were always, to be honest, one of the first ones pushing to get kids back in school. And I would continue that, in this case, would probably be what we're trying to do as well. So we want to keep kids in school, and to do that, if it's putting on a mask for a few weeks, it's putting on a mask for a few weeks. I also think, for me, kids having the access to a vaccine up to age 12 is important for me, personally. I think families that have reached out to us have asked for that. I know it's not every family, but for those people that are waiting for that, that is an important thing for them. And, I think it's something that it needs to be considered, so. Any other comments?
Well,
Go ahead, keep going.
I just want to make one more too. If I'm reading between the lines, listening to everybody too, there's, we know what our state and federal health organizations are telling us to do, but by saying recommending, they're saying we should do it, but it's easy for a district to say we're just going to recommend it. We did, to be fair, we came back to you, Kate and Dr. Stallo and staff, and said, give us metrics. And at the same point, our state and federal health organizations that are passing along this recommendation aren't giving us metrics. So let's be fair. We can watch data, but when we create metrics, we are not doctors sitting around the table, correct? So really what we have to lean on is the data we're getting from the local county. And I feel much more comfortable that we have multiple ways of looking at that data for the secondary schools. And to be honest, I feel, even though we asked for those numbers, I feel a little squishy about implementing those for the younger grades, because we're doing our best to read between the lines and read the data and talk to doctors. But the people above us who are asking us to put masks on are not giving us numbers to follow. So while I appreciate all of that effort, I feel a little uncomfortable with those lower grades saying, okay, here we are, we're doing our best, and we're going to use these numbers, right? So I think it comes back a little bit to what you were saying, Julie, too, is that, and maybe you too, Amy, just like, let's protect them, let's see what happens, and let's watch those trends. But I don't know how confident I feel about saying, and this is what our school board came up with. We'll use these numbers for those younger grades. Does that make sense? And so I guess my comfort level is not with using those with the younger grades, but saying, we are here to protect the health and safety, and if we don't have them in-person learning, we've seen what those outcomes can be. It's not true for every student, but most of our students do so much better in person, social and emotional, academic achievement. And if you talk to some teachers and principals, they want their kids in the building, not at home. So I guess I just thinking more about those metrics. The powers that be that are medically trained are not giving us those metrics. So we got to use the data we have.
So you're proposing pre-K to 8th grade, not have to
Not
start
have a
out-
metric to start.
So start with mass, and then 9th through 12th would have the 50.
I'm comfortable with what our approach is, the multi-level approach to watching if it's starting to be crazy at the secondary level, yeah.
Thoughts?
So what drove the 50 number for the high school? How did we decide that was the number?
We kind of based it off last year. We wanted to use data that the public was used to, and some of those benchmarks were based on what was used last year, as far as when kids went into hybrid learning and when we went to all distance learning. And we also wanted to keep in mind that secondary students were eligible for vaccination, so we could go a little bit higher knowing that they were eligible.
So,
The other indicator, the other reason, and again, you know, we're using a scale that was set up for something, you heard Lisa say that. The scale was set up for the transition of learning models. We looked at that and studied that and set it up for this. The other indicator, and again, it's different now because the vaccines have become available, but when we saw 50 cases per 10,000 for 14-day, from a staffing perspective, that's when we really started being in trouble in terms of operating. And that's one of the indicators that we have to look at. We knew last year if we had 5 bus drivers out, we were going to be in trouble. So we were tracking not just student and teaching staff data, but we're tracking the absences of our child nutritious services staff, our bus drivers, others. Again, that could change. We're anticipating it will because of the vaccine being available, but that was another one of the indicators. At 50 was when we really started seeing some concerns with operationally being able to continue to keep our schools open.
I get that. I think the difference is, you know, which you touched on, is the vaccine eligibility. And again, I would remove the number and say, let's manage it as it comes. That's just, and it could go either way. Meaning 50 could be a number that matters and it can be a number that doesn't matter in terms of affecting our staffing or our schools. We don't know.
Turning 50 into if I'm hearing you right, it's sort of like turning 50 instead of into a red light where it's going to change. It's a yellow light that's flashing that says, hey, should we be looking around and considering a different direction?
It could be, but it could
if-
be other things that are happening,
Yeah.
like spread, like we could have other problems at the high school that start before that because it's very,
We may need to,
in one
we may
area.
need mitigation
Yeah.
at 35 or 40,
and it could be 100.
and it could
I
be
mean,
100.
And that's, again, I'm not a medical expert, but that's one of the reasons we used both the Scott County Public Health case data as well as the ILI, as well as number of cases per classroom to get after that. So the promise I'll make, and again, by the end of this, I need some direction because I need to come back to you with a resolution and a safe learning plan. And I just lost my train of thought. And I'm sure I'll bring it back.
You need direction.
You need
I mean,
clear
it's-
direction.
Yeah, we're not exactly being clear at this moment.
Well, I hear some clarity. I hear some clarity around pre-K 8. I hear clarity around, thank you for the metric. We are more comfortable requiring pre-K 8. And we'll continue to watch that. I remember now what I was going to say. Our flow of communication, and this will continue. I meet, and you heard Lisa say this, Kate and I meet every Thursday with Scott County Public Health. We get the most up-to-date data at that time. We have reinstated a weekly COVID-19 incident command team meeting. I did not think we were going to have to do that this year. I thought maybe we could meet from time to time. We restated that when we met last week. We restated that that will be a weekly meeting directly following. So at 3 o'clock on Thursdays, that's when we'll meet. And we'll be looking at this data as well as a whole host of other data. So what I want you to be assured of is that we will continue to monitor data. I think you saw last year, we didn't hesitate. I didn't hesitate to make changes. I didn't hesitate to contact you, to inform you based on the data, based on recommendations from an incident command team, and we made changes. Again, I want to hear a little bit more and get a little bit more direction, especially around 9th through 12th grade. But I think I have a clear understanding of where you are with pre-K 8.
I'm not, you might be more clear than I am about pre-K. So I feel like a couple of us were fairly clear about we'd be okay with it, not really, with it being more about the vaccine than about metrics, than about numbers. But I don't know if that was a clear direction by any means. I don't know.
And I don't know if we
how
need
many
it right
people
now.
shared that view.
And I don't know if, I don't know that you need to say tonight. We are going to start in pre-K 8 masks, and we're going to come out of them on September 25th. Like, I don't think you have to say that. What I was trying to say before is what you can be assured of is that I will have a team weekly around me looking at data, and we will come immediately forward as things change, one direction or the other.
I was one of the people who specifically asked for metrics. And as we discuss this tonight, I'm feeling like I want the metrics to be guidance and not to be hard and fast. We have a number, we have to take an action. I feel like empowering you with a little bit
Can we
more.
separate? Because I'm hearing very clearly, so I want to be sure that I'm hearing clearly. I'm not hearing an interest in using the metric and the matrix at the pre-K 8 level.
That's correct.
I'm not hearing,
On my end.
and I'm also hearing some, we're not sure about what the off-ramp or
Yeah.
end date looks like. And you know what? That's okay. I think that's okay right now. We didn't know the Delta variant was coming. Where we were June 1st of last year and how I thought, and we all thought, and probably everyone in this room thought we were going to be opening the year looks different.
Where's that end of the table on the elementary part?
Pre-K.
Pre-K.
I think we have to be nimble and fluid and open to new information and not be tied to a matrix. But I also, like I said, I don't think we're holding out for a vaccine for that age group. If we see we're peaking, as people are predicting in the next few days, and we come back down and have low rates of transmission, there's a lot of opportunity there to take the masks off, potentially, in my opinion. But we may not all agree.
That's okay. We don't have to.
We don't have to, but
I have a question about, so I think if we're agreeing that we don't want a hard and fast E8, right? We just are going to start that way and watch the data and the trends, and we know that Incident Command will meet every week and will keep us updated. Second part, secondary. I hear your concerns about that number. here's what I recall from last year, and correct me if I'm wrong, but we would have board meetings where we would have updates, updates from our team who was on incident command with you. So as I recall, there were times we had Jim Quorum come and tell how many teachers are out sick and do we have enough subs? And Jim or Maureen would come up and say, we're struggling in transportation or in custodial department. And we would get reports on how many students are out. If we aren't comfortable setting that number for that means mask, would we consider being comfortable saying yellow light means incident is going to address this? Look at that data and make a recommendation.
We look at, that happens regardless of
Right.
anything you say at the table tonight. That my response to you is that happens weekly, and I have a team that does that weekly. So that happens.
Yeah, I'm sorry, so you're right. I know that happens, and does that address the concern? Do we want to, instead of saying, and at 50 masks go on in high school, do we say incident command will let us know that we are missing students, missing staff, whatever? Because you're telling me at around 50 last year, we had trouble with staffing and everything else. I'm comfortable with the metric between the ILI and or the 50 together. And that incident command is like kind of got their fingers on every area of the district. So when we got those reports, maybe the students are doing okay, but we don't have enough teachers right now. And so is that I'm just putting that out there, does that make sense?
So the other part of the resolution, because this is where this is a little too wishy-washy for me right now,
Right.
quite frankly, because the resolution that I'm going to be asking you to approve on Wednesday will say that you are directing me to implement the Safe Learning Plan.
Yep.
Right now, I'm not exactly sure what we're saying in the Safe Learning Plan, other than we're starting the year requiring masking pre-K-8, and we're going to continue to monitor data if we're not using the matrix for 9-12. So I don't have clarity around that. The second piece of the resolution, though, says that you are expecting and allowing me to constantly monitor data and the changing landscape of the pandemic. It doesn't have the resolution, but you know that the way we do that is through incident command, and that something doesn't have to come back to the board table for a vote. That the recommendation can happen. I consult with the board chair, I inform the board, and then a decision's made. So right now, what I'm struggling with is I need to know that if you're giving me that authority, if you're going to pass the resolution with that we've got some consensus around using numbers, not using numbers. Do you understand what? Yeah. Okay. So I just keep talking, because I'm trying to flesh it out, and I know that Christy's sitting there thinking, we got to write something up by Wednesday morning.
So that all makes sense to me, but the problem is what we know today is different from what we're going to know tomorrow, and the numbers are going to look different. The information the numbers provide is going to look different, in my opinion.
And that is the challenge. I mean, I think we feel, at least I felt 2 weeks ago, metrics are going to feel like, if we're basing something on numbers, we've been saying for a year and a half, follow the data, follow the data. Doing anything where we say follow the data, but we're not going to have any hard and fast rules around how you're going to respond to the data seems uncomfortable. I think it might seem uncomfortable to our parents. I keep coming back to the one thing that I don't want. The only reason I want us to use the phrase distance learning in the coming school year is because we have a blizzard. I don't want to go there again. First hour for my now senior, who used to be a straight A student, cannot happen in bed again. And so my priority is how do we keep kids in the buildings? Just plain and simple. And if empowering you and your team in consultation with us to make the decisions that you believe will keep our students in school, I will give you a wide berth. That's, I mean,
Well, and I appreciate that, Jonathan, and I hope what our team, this isn't about me, I hope what our team has proven to you and our community over the last 2 years is the seriousness which we do look at every ounce of data and then respond accordingly or to the best of where our decisions are at this time. And you can expect the same thing moving forward. Again, none of us know what's going to happen. It's far easier to lead and make decisions when the crystal ball is clear.
Yeah.
And that simply has not been the case. And that's why we're all struggling. We're struggling with living through a pandemic. We're struggling with leading through a pandemic. We're struggling with parenting through a pandemic. Yet this is where we are.
I look at this and we sort of have one advantage in Minnesota, and that's that we're not going first. I mean, Georgia, Florida, Texas, Mississippi, Kansas, they've gone first. They don't have masks on. And every day I read something about another school district closing up. I mean, that's what I don't want to have happen.
So let's give some clear direction.
Could I ask a question of Kate and Dr. Stallo?
Sorry.
Oh, Kate, I'm sorry. You can sit over there.
Get your
No.
steps in.
Is it easier for you at the high school level to navigate this if we do agree on a metric at that level where the vaccine is available? I'm asking you, how much clarity do you want from us? And as I understand it, you're presenting we'll use that case count and influenza-like illness. Does that make your navigation easier or not? That helps me say if I'm going to want to support a specific approach.
I would say the tracking of absences is significantly more difficult at the high school level.
Okay.
And reporting looks very differently at the high school level than it does at the elementary level.
So would having a line of some sort of metric based on case count in the county be helpful to you as leaders?
Well, we wouldn't have brought it forward if we didn't think we
Didn't think
needed
it was.
something.
Then I'm in support of
I think
that.
the other line that I don't know that it showed up on here was, and Kate, I don't know that I have it right in front of me, but we said that, you read it actually, I think you said if the trend continues.
Yeah, so Lisa always gives us a projection of what's going on in the county. And so, that's something we talked about. If we're going to stay at a plateau, maybe we wouldn't shift. But if next week it's projected to double, that looks very differently.
Okay.
And we would be using, if we had a guidepost, and I'm not saying 50 is, it's what we brought forward to you, but if we had a guidepost, that at least gives us the opportunity then to come back and to say, okay, we're at 52, the predictability of the trend is that it does continue for the next multiple weeks. In addition to that, here's where our ILI rate is, here's the number of absences we'd had. So, I mean, we will be making decisions with not just one data point.
Yeah.
Right, it's a multifaceted.
It is.
It is. And I do like the consistency with what we used last year. Our families are familiar with it. We're familiar with it. That guidance did come from people who know more than us. Do you know what I mean? Medically, that was passed down.
But the truth of the, yes, and the truth of the matter is, we used it for different reasons.
This is true.
It was really about learning models. We equated then the learning models to at what point was the state saying this was the time to make a change, right? So that's why we leaned into that, as well as we knew what happened from an operational standpoint once that 50 came.
So I would be comfortable saying, use the 50, know the 50 is there, and you also have all those other, numbers, all those other things that you're paying attention to. I don't think it needs to be an automatic trigger.
Pre-K 8 is masked.
Pre-K 8, I've said masked. If it makes it more manageable for incident command and for you to have numbers, to have those metrics, then let's use those metrics.
I'm hearing that's not what I heard for
No.
pre-K 8.
Yeah,
Mandatory masks.
I'm good with them. I want to keep them in school.
And we're continuing to share data with you to see when the off-ramp of that is.
Yes. That also helps parents and families plan for, for those that might have medical conditions or are uncomfortable or just not able to learn in a masked environment or might succeed a little bit better in a distance environment. It provides some additional guidance for them on what does that on-ramp or that off-ramp look like. Doesn't give a date, but it gives you some indication of what direction are we headed.
And just like this conversation isn't perfect, and it's hard, I think that's just what we're going to continue to deal with. And I can promise you on behalf of my team, we will be all in on ensuring that we really are making wise strategic decisions and using data to help guide that.
Okay, we clear?
Did we decide on a high school situation?
I think we're saying 50, and the multiple faceted points.
And other factors,
As a
Other
guidepost.
factors.
not a trigger.
Okay, not a trigger, not a must mask.
And that's kind of what happened last year as well.
It was a
So-
trend. I
so
mean, it
what-
was a
yes,
trend, like, it was
yes.
like going up. Like,
Yep.
it hit 30 and it was trending up, or
And
it
I
was,
don't disagree.
and going
This
down.
population can be vaccinated.
Right,
So
and
if
I
we're
agree.
finding that
But it might be that
we have
we're-
enough
Yeah.
people that are immune and vaccinated, that we aren't having a huge staffing problem or a big
Right.
problem in the high school, but our community numbers are above 50. That's not, you're telling me that's not a trigger then to mask?
Yeah,
If we're not having a problem in the high school?
I think our experience in the building should be far more important than what the community number is at the high school level. I mean, 50 makes you say, where are we? But if it's 50 in the community, but absences aren't rising, staff present, you don't have issues.
Or we're seeing at the county that the case rates aren't in 19 and under, like Lisa shared with us. Yeah, we will be looking at all of that.
Yeah.
But you did hear Kate say, it is hardest to collect data at the high school level.
Absolutely.
Yeah.
But at the
So-
end of the day, if they're absent and sick, or our teachers are, and we can't staff our buildings,
Yeah.
Right,
and the number's 30, we're going to
Right.
evaluate as
Exactly.
well. Or the number's 70.
right, right. That,
Yeah, I just
are we
wasn't
clear enough on that?
totally clear.
Are we clear enough on that? Or not?
I think so.
There?
Chrissy, we clear enough?
Okay.
We're difficult.
Okay. All right. That concludes that. Let's go to enrollment update.
Katie.
Sure, if you want to go there, you can do it
Thanks,
from there
Kate.
if you want. It's up to you.
Good evening, board members. Dr. Stallo. Just want to talk a little bit about our enrollment for this upcoming school year. We had talked about and budgeted for an additional 188 students for this year, and we are above that number currently, mainly at the high school. That is typical of this time of year. We're about 40 students, I should say, we're about 70 students above our number at the high school. The hard part is we just don't know which students aren't coming back from last year. And so we typically see a drop during the month of September for those students that aren't coming back. We are doing fairly well at the elementary and the middle levels. I think our 5th and 6th grade are where we're short our projected number of students. Overall, for the district, we're about 40 students above our projected number. So it looks pretty good at this point in the game. And that can change. Hopefully, we continue to see parents enroll their students in our district, and we will see that number increase as we get closer to school starting. So that's where we are in enrollment. Any questions?
Kindergarten?
We're really close. We're about 6 students from our budgeted number, 601 right now.
Short 6.
Short 6. We budgeted 607, we're at 601.
I'll go look for a few more.
That'd be great.
Okay, thank you. Bond refinance?
So I just wanted to quickly let you know that we do have the ability to refinance 2 bonds this fall. They're from the 2013, there's a capital facilities bond and an alternative facilities bond. One has 4 years left on it and one has 6. We can save about $900,000 over the 4 to 6 years for our taxpayers. And so I think it's worth it for the board to look at that. We would have Ehlers come at the board meeting in September, bring a resolution for a discussion on that refinancing. And we've done this before many times in the past. If there's an opportunity to save some money, the board has looked at those opportunities.
Good news. Thanks for coming forward with the good news. Thank you.
So he'll be coming in September to give us all the numbers and,
It will come to the September board meeting on the 8th, Wednesday, the 8th of September.
okay?
Any
other questions you have of me?
Julie, I know Jim's not here tonight, but as we think about the enrollment piece then, staffing-wise, I know sometimes at this part of the year, we have to come forward requesting some staffing, but we still are shy those numbers, and where kids are landing, we're still okay, other than I know Dan requested on the Laker Online.
Right. That is having an impact on some of our grade levels, obviously. Some students are coming out of our regular classrooms and going into the online, but it looks fairly good right now as far as I know. I haven't seen any outliers, but there could be some. But as far as I know, I think we're doing fairly well.
On that,
Yep.
on that front, on that topic, and maybe Dan, you can address this as well. What we're doing with online right now, obviously will be fluid. It's entirely possible based on what happens on Wednesday and this conversation tonight. I would assume that we may be seeing families going in and out of that option or making changes to what they want to do, what's best for them. So how prepared are we for that to be flexible, number one? And the second thing, I guess, that I thought when I saw the request for additional staff is, those students are already our students.
The majority of them, yes.
The bulk of them are already our students. So in a sense, I feel like, just from a budget standpoint, should we be shifting existing staff to cover that? Or, I mean, we're adding, how does that work?
We've looked at that, and that's what I think Dr. Stallo was alluding to, is do we have that ability? And we don't. They're coming at 2 here at this grade level, 3 at this grade level. We have about 75 elementary students and about 75 secondary students. So it's split pretty evenly at this point. And so we don't have that ability right now to say, well, we had 20 kids come out of 4th grade at Jeffers Pond, and they are all going to, so we have a 4th grade teacher available now that could go to distance learning. That just isn't how it's working. It's 2 here, 2 there, this school, that school. And so it really is only reducing class sizes within the physical buildings, and we need the additional staffing to be able to provide for those distance learners.
Okay.
That answered that question. I believe it did.
I think that answered that portion, and I'll speak to the other flexibility.
Yeah. Yes.
Yeah, I'll step in, speak to the other piece of the potential flexibility. Given the resolution that will be brought forward on Wednesday, we could be prepared and are prepared that we could reopen registration. I say this very cautiously, with a very tight window, pending board action on Wednesday afternoon. We've had conversations. When I say we, I'm speaking of both Melissa Knettel, who's overseeing the elementary portion, Dave Brown, who's overseeing the secondary portion, that we could send a follow-up email out to our parents and asking them to state their intentions once again, with the assumption that there may be some that want to transition who said they wanted Laker Online in that August 10th to 17th window of time and want to come back, or vice versa, we're planning that they would remain in person and now want to go to Laker Online. So we could be prepared for that, should that be the desire of the board.
I think the important piece there, and I just want to be sure that I state a second time what Dan said, it's going to have to be a really tight timeline. You know, I want to be sure that families have that opportunity, especially given a potential change that the board will approve in terms of especially the masking requirement Wednesday afternoon. But in order for us to be able to staff and get prepared, it's going to have to be a